Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Spirometry. Spirometry is actually recording the exhaled volume. If you record the exhaled volume with time, then it is versus time, then it is spirometry. So in spirometry, you are asking the patient to take deep breath. You ask the patient to take deep breath and to exhale the air with maximum force. And then that exhaled air is plotted with the time. So exhaled volume with the time, if you plot, the graph will be something like this. So here the peak expiratory flow rate in 1 second. Here in 1 second maximum amount of air will be expired. So because maximum amount of air will be expired in just 1 second, this is peak forced expiratory volume in 1 second. And forced vital capacity. So forced expiratory volume in 1 second is the maximum amount of air that is exhaled in 1 second. This is almost equal to 70 to 80% of all the air that is expired. So it is 70 to 80% of forced vital capacity. What is forced vital capacity? Forced vital capacity is the maximum amount of air that is exhaled after inhaling. After inhaling as deep as the possible, maximum or total maximum amount of air that is expired is forced vital capacity. Whereas forced expiratory volume in 1 second is the amount of air that is expired in 1 second, only in 1 second. So almost 70 to 80% of air is expired in 1 second. Then we can also measure peak expiratory flow rate. Peak expiratory flow rate is maximum amount of or maximum rate at which the air will expire. Air is expired, or maximum expiratory flow rate which is achieved is called as peak expiratory flow rate. Then we can also measure forced expiratory flow. Forced expiratory flow is the rate of air flow which is recorded um, with the forced vital capacity. While doing forced vital capacity, the maximum amount of air rate or flow rate that is measured is forced expiratory flow. So this forced expiratory flow can be measured for 25 to 75%. And this forced expiratory flow between 25 to 75%, or this is the average flow rate which is seen in the middle 50% of the forced vital capacity. That is, if in the same graph, if this is the uh, forced vital capacity, this is the all the amount of gas that is expired, and this is the expired gas in 1 second. Forced expiratory volume in one sorry forced expiratory volume in 1 second. And now, from if you calculate forced expiratory flow rate between 25 to 75%, so this is the middle, this part. So this is the 25%, this is 25%, this is the middle percent. So this part is forced expiratory flow in 25 to 75%. This is forced expiratory flow between 25 to 75%. And this forced expiratory flow between 25 to 75%, that means middle 50 of the forced vital capacity. So what is the use of this? This forced expiratory flow between this forced expiratory flow between 25 to 75%, this is actually important in measuring the small airway disease. It is very sensitive in measuring the small airway narrowing than forced expiratory volume in 1 second. In spirometry is actually effort independent. If there is any obstructive disease in the small airways, only if there is obstructive disease or narrowing of the small airways, that is when we see this abnormality in forced expiratory flow rate in 25 to 75%. In small airway narrowing, the abnormality is you will see depression in forced expiratory flow rate in 25 to 75% is seen. It is depressed. Now, so in forced expiratory flow rate or forced expiratory flow rate in 25 to 75%. So if you see in small airway disease, forced expiratory flow rate 25 to 75%, this will be decreased. Whereas if you calculate the forced expiratory volume, if you calculate the forced expiratory volume in 1 second divided by forced vital capacity, this will be normal. Whereas if you see in obstructive diseases, if we calculate the forced expiratory volume in 1 second by forced vital capacity, it will be found to be decreased in obstructive diseases. Though in early stage it will be normal, but in later stage, in obstructive diseases, in early stage this might be normal, but in later stages this will decrease.
Thank you and thank you for watching.